Hello people, welcome to Crazy Farm, and in this video we will see about calcium channel blockers. Broadly, calcium channel blockers can be classified into three different types: T-type, L-type and N-type calcium channel blockers. These T-type calcium channel blockers include flunarizine and ethosuximide. Ethosuximide is an anti-epileptic drug and flunarizine is used for migraine prophylaxis. And these L-type calcium channel blockers are what we'll be discussing about in this video in detail. And we also have N-type calcium channel blockers, and examples of N-type calcium channel blocker include omega chronotoxin. Now, coming to the L-type calcium channel blockers, we can further classify them into phenylalkylamines, benzodiazepines, and dihydropyridines. So we can broadly call these two categories as non-dihydropyridine type of calcium channel blockers, and verapamil and diltiazem are the non-dihydropyridine type of calcium channel blockers, while the dihydropyridine type of calcium channel blockers end with the suffix dipine, D-I-P-I-N-E. This is the common suffix of the dihydropyridine type of calcium channel blockers. If this is the first time you're looking at these drugs, then I would recommend you to pause the video for some time and try to get yourself familiarized with these drugs: nifedipine, amlodipine, felodipine, clevidipine, nicardipine, cilnidipine, and nimodipine. Now, coming to the mechanism of action of these drugs, these L-type calcium channel blockers go and bind to the alpha-1 subunit of L-type calcium channels and block them. And we are bothered about two different actions here. Okay, that is their action in the smooth muscle cells which are lining the blood vessels, and the action of these drugs in the cardiac myocytes. Okay, ultimately, regardless of the site of action, when calcium channels are blocked, calcium concentration inside the cell will decrease, and we know that calcium ions are very important for excitation contraction coupling, and that process, excitation contraction coupling, cannot take place if calcium channels are blocked. And now, when calcium channels are blocked in the vascular tissue, in the smooth muscle cells lining the blood vessel, it will result in arterial vasodilation and lower the BP, which will result in reflex tachycardia. While when calcium channels are blocked in the cardiac myocytes, it will result in all these effects: negative inotropism, reduced force of contraction of the heart, and negative chronotropism, reduced heart rate because of the action in SA node, and negative dromotropism, that is slowed conduction. AV nodal conduction will be delayed and slowed down because of calcium channel blockade in the AV node. So these are the various effects that can be expected in the heart. Now, we have to understand two more points here. One is that peripheral action is more for the dihydropyridine type of calcium channel blockers, like nifedipine, which means that this action is more for dihydropyridine type of calcium channel blockers, and central actions are more for non-dihydropyridine type of calcium channel blockers, like verapamil and diltiazem, which means this action is more predominant for the non-dihydropyridine type of calcium channel blockers like verapamil and diltiazem. So the dipines are more prominently used for the treatment of hypertension. They lower the BP, but some of them also cause reflex tachycardia. While verapamil and diltiazem are mainly used for this effect, where they have direct central action on the heart. Okay, now coming to the therapeutic uses of these drugs. First therapeutic indication is hypertension, for which dihydropyridine type of calcium channel blockers are preferred, especially amlodipine or cilnidipine, these kind of drugs. And we know that calcium channel blockers are very useful, unlike the beta blockers, where in some cases in diabetics and people with peripheral arterial disease or asthma, beta blockers are not preferred. In those kind of cases, we can prefer calcium channel blockers. And in people aged over 55 years, the renin-angiotensin aldosterone system might not be that strong. It might be weak. So targeting the renin-angiotensin aldosterone system by giving angiotensin converting enzyme inhibitors or angiotensin receptor blockers might not be very prudent. And rather, if calcium channel blockers are preferred as the first line drugs in these population, it will be more therapeutically beneficial. Now, angina. Coming to angina, they can be used in any type of angina, but especially when it comes to Prinzmetal or vasospastic angina, because of the coronary vasodilatory effects, the dihydropyridine type of calcium channel blockers can be used. And in migraine, as I mentioned earlier, T-type calcium channel blocker, flunarizine, is preferred. And in case of premature labor, sometimes nifedipine can be used. Nifedipine can cause relaxation of the uterine myometrium and can delay or prevent premature labor. This is an interesting indication for subarachnoid hemorrhage. Following subarachnoid hemorrhage, there can be vasospasm of the cerebral blood vessels, which can cause ischemia to the neurons. I wouldn't want that to happen. I wouldn't want neuronal death to happen. So nimodipine is a dihydropyridine type of calcium channel blocker, which is preferred, which is FDA approved for this particular indication. And in cases of hypertensive emergencies, I should use intravenous dihydropyridine type of calcium channel blockers, like nicardipine or clevidipine. Often these are combined with a beta blocker and given in order to counteract the reflex tachycardia. Okay, now supraventricular tachyarrhythmias, verapamil and diltiazem may be used. Now, coming to the adverse effects of calcium channel blockers, verapamil and diltiazem can cause first degree AV block. We know that this can happen because verapamil and diltiazem act predominantly on the heart itself. They slow down AV nodal conduction and will have negative effects on the heart, and it's very logical that they cause this kind of side effect. Constipation is a common dose related side effect of verapamil. So constipation occurs because of relaxation of smooth muscle cells lining the gastrointestinal tract. Gastroesophageal reflux disease may be worsened by DHP type of calcium channel blockers. This occurs because of relaxation of gastroesophageal sphincter. So because of the relaxation of gastroesophageal sphincter, GERD can be one of the consequences, or it can be worsened by DHP type of calcium channel blockers. And ankle edema. Ankle edema is one of the side effects of dihydropyridine type of calcium channel blockers. This is because of increased tone of post-capillary sphincters and increased capillary hydrostatic pressure, which will lead to ankle edema. And last but not the least, dizziness and headache. Dizziness and headache are manifestation of hypotension, often seen with DHP type of calcium channel blockers, which tend to produce excessive vasodilation, sometimes leading to these kind of side effects. Thank you. If you like the content, please like, share and subscribe.